Hi everybody, this is Lila Lewinstein. For this week's case, I'm going to do case 11.1, Greg the Picky Eater. Um, so for this case, it mentions that Greg is a 3-year-old boy. He does not talk much. He tends to prefer juices out of his sippy cup over solids. And then when he does eat solids, it's a lot of simple carbohydrates like macaroni and cheese, and white bread, mashed potatoes, that sort of thing. He does not like more complex foods like hamburgers or vegetables. And then when he doesn't like the foods, he has a tendency to throw them on the ground or kind of have a tantrum. So for the first question asks, what are the signs that Greg's feeding problem may be related to his speech? For me, looking at this case, it kind of seems as though Greg might be on the autism spectrum. Um, and due to the developmental delays and the inability or um, unwillingness to talk, I think that could have a lot to do with his feeding problem. It says in our textbook that children suspected of developmental delays tend to prefer liquids over solids, and we're seeing that with Greg since he tends to prefer his sippy cup over solids. Um, they also have a more simple palate, so as a 3-year-old, Greg is kind of preferring foods that um, maybe a 2-year-old would prefer, and his palate isn't really growing at the same rate as other children. Um, he tends to like the same few foods and he doesn't like to venture out very much. He throws tantrums when he's not given the foods that he wants. So the second question asks, because Greg is growing well and meeting his energy demands, why not wait for him to mature to accept other foods? There are a few issues with just waiting for him to accept other foods, especially with his developmental delays. One being that he may not accept other foods eventually unless there is some sort of intervention or um, strategy to kind of increase his palate. Another reason to try to expand his diet is because Greg is at greater risk for food contamination because fork mashing and blending foods and a lot of the softer, easier texture foods can increase risk of bacterial contaminations. Um, and when kids grow up and they just continue to eat soft textured foods, that can get kind of risky. Um, a third reason is that Greg may not be getting the adequate amount of nutrients, vitamins, and minerals that he needs, even if he is getting enough calories. He may be lacking calcium, iron, any number of vitamins or minerals, except for the vitamin C and vitamin B, which he is getting plenty of from the juice. And that could lead to issues when he's older, such as bone health issues like osteoporosis or anemia or something along those lines. And for the third question, which states, why would there be concerns with the pediatrician's statements that Greg will eat when he is hungry? So the main concern with that question is that Greg may not respond like other children to hunger. Our textbook states that children with developmental delays may not respond to hunger and might be totally fine with their sippy cups and their juices. And they might be fine with getting all of their calorie needs from juice, which can present a few problems, such as like dental issues, too much sugar, not enough protein, not adequate amounts of fat. So it's kind of concerning that his pediatrician told him to just wait until he's hungry, because that may not be the case for children with developmental issues. Yeah. All right, bye guys.